Welcome back. It's Medical Monday with our hospital experts at East Cooper Medical Center. And today, Dr. Dennis Schimpf, a plastic surgeon, is here to talk about the cosmetic and reconstructive procedures available to patients at East Cooper. Doctor, thank you for joining us.
Thank you.
Now, if you could just talk to us about the different types of surgery. There's plastic, cosmetic, and reconstructive, but they're all different,
Yes,
right?
ma'am.
So let's
Yes.
start first with plastic surgery. What's that?
Sure. Plastic really refers to the restoration of form, whereas when we talk about reconstruction, we're really talking about improving or returning function, which is obviously different than just
Right.
form. And then finally, cosmetic surgery really looks to improve on your current form.
Okay.
So
So something like maybe if you're kind of unhappy with it a little bit and you just kind of want to make some little tweaks to it or enhance it,
Sure.
if you will, then that would fall under that
Yes, ma'am.
category.
Yes,
All right.
exactly.
Now, if someone has had plastic surgery in the past, and let's just say they're not quite happy with the results that they have received, are they kind of stuck with that, or can they, I wouldn't say reverse it, but have
Sure.
it fixed?
Sure, that's a very good question. And one of the areas that we see that a lot is with breast cancer.
Wow.
You know, patients are very concerned about surviving the cancer
Of course.
aspect. A lot of the reconstruction that was done years ago is not nearly as advanced as what we have today. Patients who underwent radiation years ago now often have pain and discomfort and tightness from implants and previous reconstructions. Today, with the technology and improvements, we have procedures where we can move tissue and improve really not only their function but also their appearance. So I think it's important for women to know that although they've survived the cancer and things are going great, we can always improve on sort of their appearance as well as perhaps how they feel.
Okay. And those options would include what specifically?
Well, they would include anything from replacement of implants. Today the implants are certainly better, the technology's better. But it would also include different techniques. Today we do remove tissue from the abdomen and move it to the chest. That's referred to as perforator flap reconstruction. The downtime, the recovery is much less than it used to be. So I think those options become more and more viable for patients today.
All right. Now, here's a question, is someone ever too old for plastic surgery? And another part to that question would be, are there any complications the older that you are that you might encounter?
Sure. I think today the bigger concern is just their overall health. We don't use a number in terms of age to say that somebody can't have plastic surgery. We're operating more and more on patients in their 70s and 80s, and they're doing extremely well. So I think I wouldn't exclude somebody just based on age. I think it's more important their overall health. And if you're healthy and you want to do something to improve not only how you appear but how you feel, I think it's a great idea.
Now, with that being said, is there some type of health screening that's done prior to that to make sure, or is that something that they would have to do separately, go to their general practitioner, get a clean bill of health per se, and then come see you guys get it done, or do you do that as part of it?
That's a great question. We do it with them. We work with the primary care folks. We work with the anesthesia folks who are going to be putting them to sleep. We assess their overall health and any medical problems that they have, and we certainly line up and get those tests done ahead of time to make sure that they are at a very low risk for having the procedure done.
That's right.
More and more of the procedures are done in an outpatient setting, in an office, under more IV sedation, so the recovery is quicker, and patients do great.
Okay. Now, one last question. Is there a particular checklist that someone should have when they're choosing a plastic surgeon?
Sure. I think the thing I really get asked is what's the question I should ask a plastic surgeon? And I think the most important one is, as a patient, are your expectations realistic? I think undergoing procedures like this, they are elective. Oftentimes patients are putting a lot into these procedures, and you want to make sure that what they're expecting and hoping to get is in fact what they get.
And also make sure that that particular surgeon can deliver that, or that's their specialty.
Yes.
Because you would want to go to someone who specializes in whatever it is that you're
Yes,
doing,
ma'am.
correct?
Yes.
All right. Well, Dr. Schimpf, thank you so much.
Thank you.
Great information. So if you're thinking about plastic surgery, consider East Cooper Medical Center. Well, stay with us. We're back in just a moment.